I'd like to thank Ushi Kessler and all the volunteers of Pennies in Action for their tireless support for the last 13 years. Without Pennies in Action, there would be quite a few less patients walking around the world today who had the opportunity to receive either our vaccines or some form of immunotherapy that may have truly saved their lives. Without your tireless devotion and your ability to run events and to raise funds, a lot of these patients would not be here today. In addition, because of your willingness to go out there on a limb and raise money to treat the initial patients in which Pennies in Action alone supported, it has now grown so that many patients are being supported by additional trials from grants we've been able to earn from the government, like the Department of Defense and the NIH. And so your outpouring of generosity of your time, money, talents has made an enormous impact on patients throughout the world, as we've treated patients from most of the continents in the world. The only one we haven't treated anyone from is from Antarctica. So you truly do make a great difference in this. Not only has this impacted patients, but you'd helped to train a new generation of scientists that are going to be the next hope for bringing immunotherapy to cancer patients. You've helped bring a new generation that's interested in science from high schools and colleges and offered them opportunities that they would have never had it not been for Pennies in Action. So for multiple reasons, from the bottom of my heart, I want to thank all the volunteers at Pennies in Action, and especially Ushi, and hope that you have every success and every great opportunity you could have come to you in your life. And I hope I can still count on you to continue to participate with us in this cause. When we first started 13 years ago with this, we started with a concept that we could take the patient's own immune system, a particular cell called the dendritic cell, that we could activate it and put it back in a patient to treat their cancer or prevent new cancers. In the 13 years, we've learned that there are other things that we can do to the immune system to treat even the most advanced cancers. We now know that this dendritic cell vaccine, of which I don't even call it a vaccine because it's really an immune therapy, can be used to build blocks that will treat even the most aggressive cancers without chemotherapy. We are in a phase where we are doing two things. One, we're taking the patients with advanced cancer. We're actually using the dendritic cells to boost their immune response, their lymphocytes in their blood. We can now take them out anytime, multiple times, and expand them up out of their body using the same dendritic cells that we give them to stimulate their immune response. And we can transfer all of those lymphocytes back into their blood to go fight their tumor. On top of that, we've learned what the immune response, what components of the immune response are critical to causing the breast cancer cells to die. And we can amplify that little protein that's made by the immune system to actually supplement the whole immune response. So in the last couple of years, I'll give you an example of something that is spawned out of our initial vaccine work. we've taken the protein called interferon gamma that is made by the lymphocytes that are activated by our dendritic cells that we give, and we've actually taken that protein and given it to patients. They can inject themselves 3 times a week under their skin while they're receiving a low dose of chemotherapy with the 2 antibodies that treat HER2 breast cancer, Herceptin and Perjeta. And if we do that before they go to surgery, 60% of those patients, all their cancer is gone before they get to surgery. Now, most patients treated that have that type of breast cancer with harsh chemotherapy have only about a 25% rate of which all their tumor disappears. And that includes taking all the toxicity of the high doses of chemotherapy they get. We lowered the dose of chemotherapy and we increased their odds of having all their tumor disappear. How does that translate? More women are walking around long term because that translates into an improvement in survival. So we're using the immune system to be smarter, to fight harder, and take away a lot of the toxicity that patients go through in treatment of their cancer. Another example, we've taken those dendritic cells that we give patients, we can give them, we can inject them into their body, and it boosts their immune response. The immune response doesn't always want to go into the tumor because the tumor makes molecules that say, don't come bother us. We've, working with another company, identified an antibody that helps to allow the immune cells we make go into the tumor. So they just don't stand around in the circulation and wave aimlessly at the tumor. So we've done in mice is taken a combination of the DCs that we were using 13 years ago, and if we give mice that have these tumors that are growing, we give them this antibody, the tumors completely disappear. And we can let them get to very large sizes and they still disappear. And not only that, we can take 2 tumors and put them in the mice and only treat one of them, and guess what? The second one still goes away. So what it means is that we can make, by treating just one tumor, we can make the immune response so strong that it can take care of tumors everywhere in the body. That's another thing that we're now taking from the lab to patients. We're submitting a grant to the National Cancer Institute in a few weeks that is actually taking this same therapy we're doing to these mice and moving it into patients with cancer. We're doing that with triple negative breast cancer. Another thing we've developed is a lot of patients that have triple negative breast cancer or HER2 breast cancer do pretty well with the treatments around their body from the antibodies that are given and the vaccines we do, but they have trouble in their brain and in their central nervous system. They can get brain metastasis, they can get spinal metastasis. We've developed models in mice where we can actually give breast cancer cells directly into their spinal cord that will mimic human breast cancer spread to either the meningeal surface or the brain. And we can take those same dendritic cells and inject them into the cerebral spinal fluid or put them in through a catheter in a port, and they will wipe out those tumors in the brain. That is being tested in the next few months in patients with brain cancer and patients with what we call leptomeningeal disease or spinal cord metastasis from breast cancer. 2 diseases that are lethal. Currently, the only treatments for these patients are radiation. And I don't know if you've ever seen a patient that's had brain radiation. I had a neighbor that, unfortunately, she passed away, had a brain tumor, and she got radiated 3 times for continuous brain radiation. By the third one, she basically didn't know her name, her address, or anything, and even had she survived the breast cancer, she wouldn't have been in such a good state that she would have enjoyed life. And so we need to be cognizant of the side effects of our treatments. And not only does something like that have minimal effects, it causes a lot of deleterious side effects that we don't want. And so we're using these vaccines combined with some immunotherapies to help the cells get in there to treat both brain metastasis and spinal metastasis. And this is being supported by the Department of Defense. And this treatment is going to go on both down here in South Florida at Moffitt Cancer Center and at Roswell Park in Buffalo. And there may be at 1 or 2 other centers that this is translated to as well. The third area that I mentioned is for patients with metastatic disease. Patients with HER2 breast cancer, we can often, if they have metastatic disease, we can often keep it at bay for periods of time, but they become resistant to the therapies. And we know this protein I mentioned before, gamma interferon, actually can reverse resistance of these breast cancer cells to these HER2 targeted agents. So the best way to make a person have gamma interferon is to rev up their T cells, because they're the ones that make interferon. So what we can do is take the same dendritic cells that we've been working on for the past 13 years, and we can inject them into patients that have metastatic HER2 breast cancer, and they will make the T cells get activated. We can then draw off from their blood with a simple blood draw those cells. We can then use the dendritic cells that we have from the patient, go to a lab, and we can expand up those T cells into billions. We can then give them back intravenously to the patient, and then take the antibody I said helps the T cells get into the tumor, and even inject one of the tumors with dendritic cells and treat their metastatic breast cancer, and then make them again sensitive to Herceptin and all these HER2 targeted agents. Because we can do this from the blood, we can do this over and over and over again with a simple blood draw once we've activated these cells. So those are just 3 examples of things that are happening right now in breast cancer. And the nice thing is that all of these things that I've described are applicable to other cancers as well. We can do the same thing injecting dendritic cells into a prostate cancer, into pancreatic cancer. There is no limitations. The brain metastasis can be used on primary brain cancer. There will be no limitations to what can be done with these cells. We can switch the targets. Eventually, what we've done because of this model that we've made is we've been able to go and now go back to early cancers, identify the proteins that are abnormal in them, and we can actually go and make preventive vaccines. So in the future, no one's even going to have to go through surgery, chemo, radiation, or immunotherapy, because we will have eliminated the potential to do this. And if any of you have ever known, I'm sure most people that are watching this video have received a vaccine of some kind or another, you realize that the most effective medical invention ever designed is a vaccine. Why? Because it's cost effective and it's preventive. Why get the disease if you can prevent it? And so we're doing studies now designing vaccines for preventing breast cancer that we're doing to prevent recurrence. So we're right now more akin to the chickenpox, the chickenpox vaccine, where you're trying to prevent recurrence of shingles. And we're trying to do the same thing with breast cancer, but ultimately the goal will be to prevent breast cancer from ever starting. So I want to talk about 2 other uses of the dendritic cell therapy that we've come up with that are new and exciting. The first one is to use the cell therapy at the earliest time point we can in the patient's course of disease. Right now, some of the trials that are going on are using the dendritic cells to rescue patients that have high risk of recurrence. But we felt that building up the immune response before someone goes to chemotherapy is a very important component, and it's a much more efficient use of the cells to give the patients their immune response before they undergo toxic chemotherapies. So what we've done is we've designed a clinical trial where before a patient is going to undergo chemotherapy and treatment with the antibodies Herceptin and Perjeta, we boost their immune response to hopefully push more of their anti-HER2 immune lymphocytes into their tumor to make chemo more effective. In addition to this, we can use the same lymphocyte cells as a test from the blood to predict what a patient's going to do. And so what we've done is we've given these dendritic cell vaccines to patients 1 or twice a week for 3 weeks before they start therapy, and we measure their immune response in their blood against HER2 protein before and after the vaccination. Interestingly, in a group of patients who their immune response after vaccination in their blood actually goes down, it turns out 100% of the time when they get chemotherapy, even a minuscule amount, their tumor completely disappears. On the other hand, if their immune response goes up in their peripheral blood, it gives us a different signal. Only a couple of those patients go on to have all their tumor disappear in response to chemotherapy and Herceptin and Perjeta. And we've studied this, and by using the blood test, what we now think and what we're proving is that the immune cells that we give, if the tumor's permissive and allows them to go in there, the immune response that we give them goes straight out of their bloodstream into the tumor. And when that happens, it makes their tumors become very sensitive to chemo and disappear, even with 1 or 2 treatments. What about all the patients who that doesn't happen for? How can we make them be like the patients that their tumors disappear? So we have to make their tumor now permissive to make those immune cells go into the tumor. We go back again to the mice, and what we learned when we injected our dendritic cells into the tumor with the antibody that I described for you earlier, it turns out that when you put the dendritic cells in the tumor, it calls in the lymphocytes. It makes little signal molecules that say, help, come here, there's a problem. And so we are now testing in these patients with early HER2 positive breast cancer whether we can give them a vaccine in their lymph nodes like we've given patients for the past 13 years in Pennies in Action, but now we put one of them on a different day into their tumor directly. And we're going to find out pretty soon whether we can take someone whose tumor is saying, no, we don't want these lymphocytes in here, into one that says, yes, now we want these lymphocytes in here, and they can have a complete response. If we do that and we are successful, then no one will die of HER2 positive breast cancer. So that's the power of the immune system. Not only can we use it to treat, we can use it to tell us how to treat and whom to treat and when to treat. Can we do that with any tumor? I believe so, if we can find the right markers that will tell us that the immune system will give us a sensitive clue. We've done it with triple-negative breast cancer. I suspect we'll be able to do it with ER-positive breast cancer shortly. And I suspect we'll be able to do it with prostate and pancreas and multiple other tumors. So we have all these exciting things that are happening right now that I just described. But we can't make them happen without all your support and efforts. We can only ask the Department of Defense and the NIH and other foundations for so many dollars to cover so many things. There is an unmet need in the world of cancer that we can address rapidly if we could just get the money to continue to expand this program. Without your support and your help, none of this would be possible. I couldn't hire some of the talented scientists who helped to develop these therapies. I couldn't engage the scientists who developed the brain metastasis model. I couldn't engage the scientists who learned how to grow the type of immune cells up to treat for adoptive therapy. We need you to get off the couch and join us every day to focus like we do 24/7 on this ultimate and most important cause. We're going to need you to get off your couch and help us out.